My name is Jennifer Valdez, and my presentation today is over weight loss medications. Here are the objectives for this presentation. First, we're going to review the history of weight loss medications. Throughout the PowerPoint, you will see weight loss medications abbreviated as WLM. We're also going to discuss the indications for weight loss medications as well as the recommended length of usage. We're going to discuss the application specifically in the bariatric population. We're also going to look at the differences and similarities between each FDA-approved weight loss medication, as well as the percent weight loss between the medication and placebo. We're going to review the mechanisms of actions, the contraindications, as well as the side effects. And we're also going to review the non-prescription weight loss medications and supplements that are available and are common. Brief history of weight loss medications. In 1947 was the year that the FDA approved its first medication for obesity, methamphetamine. Over the next following decades, more appetite suppressants were approved. However, in 1973, the FDA limited all weight loss medications to short-term usage due to concerns of amphetamine abuse. In 1997, the two medications were removed from the market due to reports of cardiovascular damage. Specifically, these medications were fen-phin and Redux. And in 2010, Meridia was removed due to an increased risk of heart attacks and strokes. So though there is a controversial history with weight loss medications, the attitude has shifted over the past 2 decades due to increased awareness and acceptance and a recognition of obesity as a chronic disease. The function of weight loss medications is to aid in producing an energy deficit and provide reinforcement to change eating behaviors. It should be prescribed after an extensive discussion of risk and benefits between patient and physician. This was emphasized in many articles, and also that's consistent across the literature is weight loss must be assessed after the patient has been on the medication after 3 to 4 months, and there should be at least 3 to 5% weight loss in order for the medication to be considered effective in the individual. If there is not at least a 3 to 5% weight loss shown in the patient, it's recommended to discontinue that medication. This will decrease the patient's exposure to potential risk and also the cost of drug treatment when there is low probability of long-term benefit. No one medication is effective in every patient, just as not every patient is appropriate for every medication. Specifically in bariatric patients, it is known that weight regain post-operatively is common. About 20 to 25% of lost weight is expected to be regained over a 10-year span. Trials of weight loss medication have shown that the weight loss effects of these medications are sustained only as long as they are being taken by the patient. Now, it was previously thought by patients and providers that the initial weight loss that occurred when taking these medications can be sustained by just behavioral changes. However, available evidence does not support this view. For example, hypertensive medications lower blood pressure level to optimal levels only as long as the patient is on that medication. However, once medication use is discontinued, blood pressure will likely rise to baseline levels. This is a similar situation for weight loss medications. Therefore, the most optimal strategy for chronic weight management in bariatric patients is going to be to place them on weight loss medications that are approved for long-term usage. For example, 40-year-old female patient with morbid obesity was seen yesterday at this clinic for an initial nutrition assessment for gastric bypass surgery. This patient provided a history of being placed on HCG injections when describing her attempts at weight loss. She also stated that she lost 45 pounds initially, but regained 75 pounds once she stopped receiving injections. Now, this is common for medications that are not approved for long-term usage, that there is weight regain once usage is discontinued. And specifically, HCG is not a medication that is approved for weight loss, nor is it approved for long-term usage. Here are the FDA requirements for weight loss medications. So they were required to present data for over 2,500 patients and must have results that are greater than 5% weight loss than the placebo. They must also show positive effects on various risk factors and disease markers. They must show evidence of no increase in cardiovascular risk. This was why Meridia was pulled from the market. Also, all weight loss medications are studied with the suicide rating scale, and they must also be indicated for long-term usage in conjunction with diet and physical activity to produce and sustain weight loss. So indications for prescription. So as I mentioned in the last bullet point in the previous slide, medications should be taken in conjunction to a reduced calorie diet and increased physical activity for optimal chronic weight management in adults with a BMI of either 30 or above, which is considered obese, or 27, which is above 27, which is overweight, plus in the presence of at least one weight-related comorbidity. So currently there are 5 FDA-approved weight loss medications that are indicated for long-term usage. So here is a table from a meta-analysis, Management of Obesity. And as you can see, it has all 5 FDA-approved weight loss medications, briefly describes their mechanism of action, and it also compares the average weight loss between the placebo that was found between the placebo and the drug. So as you can see, phentermine and topiramate, it looks like it has the highest average weight loss. And then on the very far right, you can see the advantages and the disadvantages of each medication. The first medication we're going to talk about is liraglutide. The brand name is called Saxenda, and it's the most recently approved weight loss medication by the FDA. It was approved in December of 2014. And its mechanism of action is that it's a glucagon-like peptide 1 receptor agonist, so it reduces appetite and energy intake. Specifically, glucagon-like peptide is a physiological regulator of appetite and caloric intake, present in several areas of the brain that's involved in appetite regulation, specifically the hypothalamus. And here are the side effects of liraglutide. 1 in 18 patients stopped taking Saxenda due to an adverse event. And here are the contraindications for this medication. The next medication is naltrexone bupropion extended release, or the brand name is Contrave, and this medication was approved by the FDA in September 2014, so it's also pretty recent. And its mechanism of action is it's also an appetite suppressant. And combined, these two, naxotrone and bupropion, has an effect on two separate areas of the brain that's involved in regulation of the food intake. And they did mention that the exact neurochemical effects of Contrave leading to weight loss are not yet fully understood. Here are the contraindications. And here are the side effects. So not too extensive, as you can see. The next medication is the phentermine and topiramate extended release, or the brand name Qsymia, and this medication was approved by the FDA in July 2012, and it also, mechanism of action is appetite reduction. So though the effect of phentermine on chronic weight management is not completely known yet, it's likely mediated by the release of catecholamines in the hypothalamus, which results in a reduced appetite and decreased food consumption. The exact mechanism of action of topiramate on chronic weight management is also unknown, and if you remember from the chart from the previous slide, this medication is associated with the greatest average weight loss than other medications. However, as you can see, it has an extensive side effect profile, and 1 in every 12 patients stop taking Qsymia due to an adverse event. And here are the contraindications. The next weight loss medication is called lorcaserin. The brand named is Belviq, and this medication was approved by the FDA in June of 2012. Its mechanism of action is that it's a serotonin T2C agonist, specifically promoting satiety. The complete mechanism of action is not yet completely understood. However, it is believed to decrease food consumption and promote satiety by activating 5-HT2C receptors on the anorexigenic neurons located in the hypothalamus, and it is known for its high tolerability and the low rate of adverse events. Here are the side effects, and 1 in 53 patients stopped taking Belviq due to an adverse event, and the contraindications, just pregnancy. And the last FDA-approved medication is Orlistat, or the brand names Xenical and Ali. Ali is available without a prescription, over the counter, in US only, and this medication was approved in 1999 by the FDA. So its mechanism of action is different from the previous medications that we talked about because it's more with the gastrointestinal system. Specifically, it prevents the absorption of fat. It inactivates the gastric and pancreatic lipases in the stomach and small intestine so that these enzymes are unavailable to hydrolyze triglycerides into the free fatty acids and monoglycerides. So due to this mechanism, undigested triglycerides are not absorbed, and this results in a caloric deficit. And it is established as one of the safest weight loss drugs due to its long history and extensive data supporting its effectiveness. At the recommended dose of 120 milligrams 3 times a day, orlistat can inhibit dietary fat absorption by about 30%, and Ali can provide about 80% of the weight loss that's seen with the prescription dose. So Xenical must be taken with a main meal 3 times a day containing fat, and Ali must be taken 3 times a day with meals containing at least 15 grams of fat. And here are the side effects. So a lot of gastrointestinal related side effects, and 1 in every 26 patients stopped taking Xenical due to an adverse event. Here are the contraindications, and it is recommended to take a multivitamin with fat-soluble vitamins 2 hours before or after orlistat or at bedtime, and it's recommended for the patient to have a diet providing 30% of calories from fat. Vitamin K absorption may decrease, so it's important to monitor the INR closely in patients who are also taking warfarin. And gastrointestinal events may increase when Xenical is taken with a diet higher than 30% of the total daily calories from fat. Now we're going to talk about stimulant weight loss medications, phentermine, bendamustine, and diethylpropion. So these are also appetite suppressants, and they belong to the anorexiant drug class. So they are only available with the prescription, and they are approved for short-term usage and weight loss, usually up to 12 weeks. And long-term use of these drugs can lead to abuse and dependence. It should be used in conjunction with diet and exercise to maintain weight loss, much like the FDA-approved medications. However, it's been shown that typically the weight loss with these stimulants may be regained once usage of the medication is discontinued. Specifically, phentermine is very commonly prescribed. It's actually the most widely prescribed weight loss medication. It, however, is not approved for long-term usage as there is no long-term data yet on its safety and efficacy. So it's most likely widely prescribed due to its relatively low cost compared to other weight loss medications, and it's highly prescribed by clinicians, most likely due to minimal reports of serious side effects, even without the data of long-term safety and efficacy. So it's shown to produce about 7% weight loss at 6 months. Patients should be informed that it is not FDA approved for long-term usage and has not been documented to be safe and effective. And here are non-prescription pills and supplements that are common. So as I'm sure most of you know, the dietary and herbal supplements are not reviewed by the FDA like prescription drugs, and they may contain unknown chemicals that can be dangerous or counterfeit, and they may most likely are costly.